Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about waiting period in healthcare domain or waiting period in medical billing. So generally, whenever you are submitting any claim to insurance and they will tell that there is a waiting period so that we are not covered your this kind of medical claims. So they will deny the medical claims stating that this services under the waiting period. So now we will discuss about what is waiting period exactly and what kind of diseases will be comes under the waiting period and what are the insurance policies generally, what will be the time period for the waiting periods we will discuss now. So before that, guys, if you're watching our video first time and if you're not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon. I mean, turn on the bell icon so that you will get every hour video as a notifications to your mobile. Okay, guys, now we are discussing about waiting period in healthcare domain or waiting period in medical billing. A period of time before healthcare coverage can begin is nothing but waiting period. For example, you're buying policy in the first date of January month, and at the time as per your insurance policy guidelines, or if your agent is telling you that there is a 1 month of waiting period from the January first date, so that is nothing but, for example, your insurance agent told you that only 1 month of waiting period, then your February 1st of that year, your insurance will start coverage for your medical claims. So there is a 30 days period, complete January month 30 days will be known as a waiting period. For example, you got some disease or you went to hospital to take a service. At the time the doctor given a service and that kind of medical claim is submitted to the insurance in the January month, and insurance will process your claim and they will deny your claim later, stating that you are covered under a waiting period. Because as per insurance guidelines, your policy coverage will begin from the February first date of that year, but your billed date of services is under the January month of that year. So clearly you are within the 30 business days, so that you are covered under a waiting period. Your once your waiting period is completed, from that only you will get the benefits from the insurance. So, and for example, within that January month you met some accidental and you got hospitalized. At that time waiting period is exceptional. So if you are admitted to the hospital due to the some emergency accidental situations, and those kind of emergency accidental hospitalization conditions are exemptions, nothing but the waiting period will be not applicable for the accidental hospitalization claims. And we have to understand that generally there is a 1 month or 2 months waiting period whenever you are buying health insurance policy from the health insurance companies. And depending, for example, if you have a some kind of severe diseases like chronic diseases you have, for example diabetes, heart attack, heart related issues, and for example high BP related, and some cancer type of cancers, so those kind of uh, conditions will have more waiting periods compared to like 1 month or 2 months. It will be goes to 6 months or 1 years also. So depending upon medical conditions also waiting period will be depends. Okay guys, waiting period related the most common diseases are diabetes, cancer, asthma, chronic kidney diseases, high BP. Example, this kind of diseases generally having more waiting period compared to like normal waiting period. So while you are taking any policy, there is like 1 month or 2 months normal waiting period, general waiting period. But if you have any this kind of diseases, example like for example you have a cancer and you are buying a policy, at the time there is a waiting period is more compared to general waiting period. We have to understand this point. Okay guys, now we are discussing about types of waiting period. And the first one is like initial waiting period. Generally there is a 30 business days from your policy date, mostly like 30 business days. That will be known as a cooling period. For example, you submitted a claim within the 30 days to the insurance company to get a medical benefits from that insurance. They will deny the claim like you are under the cooling period. So we have to submit the claim after the cooling period to the insurance. So here mostly 30 business days is the cooling period. And there is a pre-existing diseases waiting period. For example, it will be mostly 1 to 3 years, not like months, it's years. Why? Because for example you have some chronic diseases like you have a diabetes, you have a kidney failure disease, or for example you have a cancer and hypertension, high bp. So this kind of things will be chronic, the severity is more, and also you already have it. So that is why the waiting period is more compared to cooling period. And there are some specific diseases waiting period. For example, it is mostly like 1 to 2 years. For example, you have some kind of specific specific means there is a particular kind of diseases you have. For example, joint replacement. So this kind of specific diseases also having specific waiting period duration. And maternity waiting period like mostly 9 months to 2 years like maternity. And also newborn baby waiting period like it is mostly 90 days from the birth date of that baby. So we have to understand clearly that your waiting period is mostly depends on the patient, as I mean mostly depends on the patient age and also medical condition whatever the patient has. So we have to understand that here the medical condition and also age of the patient will be decide the waiting period. So that is what your waiting period will be changes and accordingly like based on diseases. Okay guys, here I given a points like insurance will deny the waiting periods. For example, patient's pre-existing condition, patient have to wait for some time to cover it. For example, you have a pre-existing condition. At the time, you should have to wait until your pre-existing condition was done. So for example, you are within the pre-existing condition, I mean pre-existing period, and you submitted a claim, medical claim to insurance. Insurance telling that we are not covered this kind of services because you are under the pre-existing period of a, for example, 2 years. For example, 2 years. So you are submitted claim within the 1 year. Then insurance clearly tell that we are not covered because the patient is under the pre-existing condition. So our job is to we have to submit the claim after pre-existing condition is done. Okay, if you submitted also they will not give any payments within the pre-existing period. And the second point is once the waiting period is over, then only the claim will be payable by the insurance company. That is we already discussed. And here I give a note point one, the duration of waiting period may vary from insurance to insurance, nothing but company to company. So some companies will give 30 days notice period as a cooling period. Some other companies will give like a 60 days cooling period notice period. So like it is a depends on a company guidelines. And second point is the number of waiting period years depends on the patient age and also disease of condition diseases. So for example, the condition of the disease and patient age uh, also will be responsible for the duration of the waiting period. For example, condition severity is very more like chronic, like critical. At the time, waiting period is like more. For example, you have a diabetes, but your condition is very high. For example, severity is very high. the condition of that particular diabetes is high, at the time waiting period is also high. So for example, they will tell like 3 years. Once you completed this 3 years pre-existing waiting period of this particular condition of diabetes, then only insurance will start giving the benefits to that particular claim. So we have to understand that based on the condition and age also waiting period will be changes. And note 3 is during the waiting period the claim never payable. So we know that. So once completed this noting waiting period, then only insurance will give the start benefits to giving the doctors. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. And again, thank you for watching and thank you for your time. Have a good health. Bye for now.